Melissa. Nice to see you. You want to have a seat? So, what brings you in today to see me?
I've been having really bad problems with my eating disorder.
Really? How long has this been going on? Is this a recent thing or?
No, it's been years, but like I've been trying to get back on track and it's not working so well.
Mm-hmm.
And comments from people are just like making me freak out. So it's making it worse.
Kind
it's
of
making it worse.
Triggering, yeah.
Yeah.
And have you been in a treatment before for this or?
I haven't been for a long time. I'm on a waiting list.
It can be really hard to get into places. A lot of people are on waiting lists. I totally understand. And that's something I can help you with when the time comes. I can, there's some people I know I can probably call and we can try to make that happen.
Okay.
Because I worked with a lot of people at the treatment centers, so a lot of times I can make a call and we can get things pushed ahead.
That would be great, actually.
Yeah, and have you ever seen anybody for it otherwise, or is this your first?
I had been admitted to the hospital before, and there was the shrink on site. And talked to him.
Gotcha. So you've been kind of what we call like evaluated, like they've come and just asked you questions, or did they sit down with you and like?
A few different like doctor or psychologist, or like they all like.
Everybody who rolls through when you're
me.
there, yeah. And I used to work in an inpatient thing like that, so I know what you mean. They kind of come in and
like
out.
Say the same thing over and over and over again, and each of them are expecting to be the wonderful one that discovers the diagnosis.
Exactly, that figures out what they need to do.
Yeah.
So before we leave today, I'll have you sign a release, and what that means is that I'll contact them, so you don't have to tell me what you've already told them again.
That would be.
And then I can get that information,
Okay.
and then that'll give us more for next time.
Okay.
Okay.
I'm happy with that actually, because it's a lot of stress for me to contact them myself.
Yeah, and that's something that I'll do. And to be honest, a lot of times they'll respond more quickly if I fax. I'll fax them and they'll fax back, and it's easier. Then you don't have to stress about it.
Okay.
So,
That's good actually. Thank you.
Yeah, and out of curiosity, when do you first remember this happening? Like, when's the first time that you remember engaging in your eating disorder behavior?
About 5 years ago.
Okay.
And I didn't worry about it before then.
Okay, but do you think there were things, like if looking back, are there things that you're like, well, maybe I was starting, or the thoughts were there?
Well, okay, before I had my eating disorder, I was concerned about gaining weight, despite the fact that I was like stick thin. I wasn't anorexic, but I was stick thin. I was very skinny. And I was still concerned with gaining weight. So it was on my mind, but it wasn't like I would starve myself or anything. I didn't keep from eating because of it. It was just like, I don't want to gain weight. And if I gained a few pounds, I was like, well, let's keep this under control.
Yeah, it was like a constant thought always, no matter what you were doing. Do you, and all I'm trying to do here is just gather some history so I kind of know where you're coming from, so then we can kind of tell where we're going. Do you live on your own? Do you live with family members?
On my own.
Okay. And have you lived on your own for very long, or?
Yeah.
Okay.
Yeah, it's been years now.
Okay.
Well, I had lived with my sister for a while.
And it's a good thing living on your own. We like it. It's easy. It's good.
Yeah, you don't have to, you can put anything wherever you want.
Yeah, it's true. And it's always the way you left it when you come back, which is wonderful.
Exactly.
No, I totally get that. Okay, and so 5 years ago, did something happen that you remember?
I was put on meds that made me eat, and I was so infatuated with food that I couldn't, and I gained weight, and I couldn't just give up the food because I just wanted it so bad. So I just decided that I was gonna eat, but throw it up.
Gotcha. It was like
it was a magical cure.
Yeah, and for a lot of people, it is that way, because if we can't control one thing, we'll control another. And the meds that you were on, what were they?
Remeron. Remeron?
Oh, Remeron? Okay. Yeah. That was cool. I was like, I know what she's saying, even with the beautiful accent. And are you still on it, or have you?
No, they took me off when they realized that was making me wonky.
Yeah, and it was causing the intense hunger where it's like never fulfilled that feeling. Yeah, and that's very common.
I was at work and I got like a few different bags of chips, different bottles of sauce, box of cookies, like a little tin of cookies.
Mm-hmm.
And just like eat that, and then just like once in a while if I had to go get something, I just like pick some more stuff up, put them on the Zamboni, and I would push it around the store, and I would put them all in there, and while I was pushing it, I would eat.
Wow, and it was, yeah, insatiable hunger is actually like a lot of people have that side effect. I'm glad they took you off of it, because that can,
oh yeah, mm-hmm.
It can be really difficult, even if you don't have an eating disorder. Like you're saying, you never remember even thinking of it before
I had
then.
never had.
And do you know what they put you on Remeron for? What was your diagnosis?
Severe anxiety.
Okay.
Because I was cutting myself.
Okay. And have you, when you were cutting yourself, had that been going on for a really long time, or?
The cutting had been going on when they found out. It had been about 1.5 years, 2 years.
Mm-hmm.
But I had been hurting myself since I was about 5 years old.
Okay, wow. So it's been pretty much as long as you can remember. There's been some form of it.
Yeah.
Have you talked about where you think that came from, or what spurred the
cutting?
Yeah.
I wanted to be the winner.
Winner of what?
Because my father, he would hit me. Okay. And I didn't want to give him a reaction, so I would practice pain.
Okay, so it was almost like you're taking control of the pain, so that then.
Yeah, so if I didn't give a reaction,
mm-hmm.
it actually made him madder.
Yeah.
And hit more, but I was proud.
Yeah, because you were in control.
I won.
Mm-hmm. You were giving him what you thought he wanted.
Exactly.
Yeah, which it's interesting how we take control back when we feel like it's taken from us, and that it's very common to want to regain control, especially when we're little and we have no other way to control.
Mm-hmm.
So I'm sorry that happened to you.
Can't change it.
No, but
it makes a person stronger.
It does, but it doesn't lessen.
Like my doctor used to say, like just be grateful. Thank your past. The abuse you went through.
Mm-hmm.
And I was just like I was angry at him. I didn't want to be. I didn't want to. I know. Like I'm not gonna thank the past at all. But now I can recognize that I did get stronger for all I went through.
Yeah.
And I wouldn't have YouTube and stuff if it wasn't for that. So.
It's true, and it always shapes who we are. But it's still sometimes nice to have someone recognize the pain, even though we've moved past. It's,
Have someone recognize the pain?
Yeah, like someone in your life recognize that you've been through a lot and say, like, I'm sorry.
Oh, okay,
that
yeah, eventually. I mean, like, my family, like, even my parents, they didn't know I was hurting myself at all. Like, they only found out after I started cutting as an adult.
Oh, okay.
And nobody knew. It was a big secret from me. Nobody knew.
Did they know that it was going on now, like that it was happening, or did they just know that it was going on?
No, they know now. They only found out because I was hospitalized, and I didn't want to tell them.
Yeah, how come?
How come I didn't want to tell them?
Mm-hmm.
I was afraid.
Afraid
of how they would react.
Mm-hmm. What they'd say or do or both? Or?
Yeah, I had nightmares about it.
Oh, really?
My mom would I would have this long skirt, and she would rip it, and suddenly my leg was revealed, and all this chopped up scars everywhere.
Mm-hmm.
And she was like, "You're disgusting."
Oh.
My mother would never do that, but that was my nightmare. It's like I was just so scared.
Yeah, it was like your tense fear of them finding out and what that would mean, and
not just like if they would react like meanly towards me, but I was afraid to hurt them.
Yeah.
Because we're very tight-knit and we very much care about each other, and I was afraid to hurt them. That was my biggest fear, is to hurt them. So I didn't want to tell them.
Yeah, kept it to yourself.
Yeah, I went to the hospital. I was hospitalized, and I didn't want to tell anyone. Even my brother, he was my boss for one of my work jobs, and I can't work on Tuesday night, and I can't tell you why.
Yeah. There's a lot that goes into keeping big secrets after a while, right?
Yeah.
And don't ask me, because I'm not going to tell you, so. That's cool that you had a nice close-knit family, though.
Yeah.
Are you still close with them relatively?
Yeah.
Or?
Yeah. My brother lives next door, and my sister's nearby.
Yeah, I've seen her on some of your videos. You're like, my sister's here. Or whatever, you'll say that she's around or something.
Yeah.
That's nice, at least. Are they supportive and helpful? And
oh, yeah. They all
and they love what you're doing? And
yeah. My mom was supportive, too.
Oh, very cool.
She was very supportive.
Are things at all better with your dad, or? I know that's a loaded question.
I called him when my mother passed away, and just talked for a couple minutes, and before that I talked to him about a year before, and I said I was gonna, I paused for a long time. I was like, this is Melissa. And he says, my daughter Melissa? And I'm like, she used to be.
Mm.
And then it was kind of like long silence, and I could tell I heard him, but part of me didn't care.
Mm-hmm.
But I did meet up with him.
Was it?
It made me relapse.
Because it sounds like he'd be your biggest trigger, if anything.
He's the reason everything started.
Yeah, because it was a way to manage the pain that he was putting you through.
Yeah, well, it's kind of I don't know. If he would admit what he did, if he admit having done things like that to my sister and I, well, I think I would find a way to have him in my life.
Mm-hmm.
If he admitted it. But he won't, so.
Have you ever, I'm assuming you've confronted him to some extent, or no?
Last year in April, I did. I went to see him, and we met in a public place, and my friend was watching, so that, I could. And so we talked actually he talked.
Mm-hmm.
He talked and talked and talked, and listed all the reasons why he was innocent, and I was just like, the worst thing that ever happened to you never happened. I was the crazy one. My sister's the crazy one. The witnesses, my grandmother, my mother, they're the crazy ones.
And that's the worst feeling, that invalidation, that not accepting.
He made me actually doubt myself.
Well, yeah, because if
I was like,
telling you
maybe I am crazy. He was so convincing.
Well, you have to think, what does he have to do to convince himself that he isn't?
I wonder maybe if he forgot. Are we getting off track?
I know. We could go on for a long time. I don't know how long you want it to be.
Okay. But we were getting off track?
No.
No, okay.
This is just what it's like.
Okay.
We just go.
Okay. That's fine.
It's like a tree.
Okay.
You just kind of fill it out.
Okay, yeah, well, it is the roots. It is the roots of everything, so. Okay.
Yeah. And,
yeah.
I mean, it sometimes, not that this isn't, I'm not in any way saying what he's doing is okay or anything, but a lot of times people who are abusers in any way, shape, or form will lie to themselves as a way to convince them that they either A, had a reason to do it, and therefore it's not their fault, it's the person that they harmed's fault, or they'll say that it never happened. And that it's almost like the way that our eating disorder voice or our self-harm voice will tell us lies so much that we'll believe them, like, I'm too fat, I'm not this, I'm not that, I'm too ugly, I'm too whatever it tells us, right? We'll believe it after a while. And my best way to ever understand that situation is that they tell themselves that lie so much that then they start to believe it. Even though it's still a lie. And it makes us feel terrible, invalidated, like all sorts of shit.
Also, like, having been under the influence of alcohol, like, I think maybe that could have, like, he was an alcoholic, like, he just, well, I guess he never stopped being he was an alcoholic, and so I think maybe having drunken so much, like...
And it can wipe your memory, but that, I feel like, and this is just my belief then, this isn't even research, because they can say that you'll forget. I mean, anybody who's ever been what they call blackout drunk will know that's what that means, you don't remember. But you always remember bits. And there's no way that
I think
something's not there.
I think part of him, like, thinks, okay, maybe I did do it or something. Like, I don't know.
But he won't admit it to himself, probably because alcoholics tend to be self-deprecating in their own mind. We don't know it because they tend to be like, but they're actually sad. Because alcohol's a downer, and people who would take a downer all the time means that they're probably very depressed. But just a sidebar. So that's kind of what it's like. It's not, I don't know, I usually let people guide it. Like, I'll ask you some questions, and then we just kind of take it where you go. Because it doesn't have to be, if you don't want to talk about one thing, like, I'll have clients all the time. Well, this happened, but I don't want to talk about it. And I'm like, oh, we don't have to talk about it. Because things will come out sooner or later. Like, if you were like, oh, my dad, but I don't want to talk about it. Like, the root of it will come out at some point through your story. And all I'm doing is trying to help you tell me your story.
And would you tell YouTube, there's this one concern that a lot of people have, that if a therapist hasn't had an eating disorder or they haven't cut themselves, how could they understand enough to be able to help you, and they want someone that's not going to judge them? What would you say to that?
To be honest, it's tricky because, I mean, I've never had an eating disorder. I've never self-harmed or cut myself, but I've spent a lot of time in different treatment centers and read a lot of books and listened to my clients and, sought to understand. I think that's the most important thing because everybody's process is different. I don't want to tell you that your experience is like this other person, Mm-hmm. If you can find a therapist that seeks to understand above all, and then you'll find a great person. They don't have to have had something, but they do have to have the compassion to seek to understand your story.
So how would they know, like let's say that one therapist is more understanding than another? Like it's kind of like trial and error. Like you have to subject yourself to like possibly having a therapist that like thinks you should just get over it and then it's nothing.
Potentially.
Like, that's pretty much how it would actually go. Terrible. I
know it's terrible, but it's really to be terrible. Honest, like to be like bare bones, completely honest, I see a therapist myself, and I've seen therapists where I'm like, I'm not going back there. I don't like them, And it sounds stupid, but when we meet somebody, you usually know, just from being with them for a few minutes, like, okay, they're okay. I'll try them out. If you're meeting a therapist, within the first 5 minutes, I will know if I like them or not enough to want to talk to them. Mm-hmm. And as bad as it sounds, in one of my videos, in setting up your first therapy appointment, I think, I'm like, you don't have to sit through the whole hour. You don't have to make another appointment.
But you paid for the whole hour.
Yeah. And that's why a lot of times I'll have my clients, when I was talking to people, I'm like, call. Like when I have some people do nutritionists and psychiatrists and stuff like that.
I've actually suggested that too. Like call them up and talk to them a little bit first.
Wait till you make contact. Don't make an appointment.
They don't have to pay for the phone call.
No, and I can tell you, I've spent hours on the phone through different people, spending 5 to 10 minutes just talking to somebody and seeing how they're so they can hear me and see what it's like and because even if
that is good actually. I think that is the best suggestion. Too, is to call the therapist, or actually ask that they call you because sometimes people are so nervous, and that is something that I've suggested several times to have them call you.
Yeah, because then you're more apt to be able to pick up.
It's just like it's not the same as dialing the numbers and
waiting
for the
as it rings and you're like the anxiety builds.
Yeah, exactly. So
totally.
Have them arrange that maybe they call you and you can talk to them and
exactly. Yeah, and I think that
you'll find a Katie.
There's got to be tons of me out there. I would assume
people actually got into the job because they like helping people. Yeah. Isn't that radical?
I know, right? So. I mean, it can be scary, but it can be worth it.
I agree. Feel like
I agree. Anything in life, like putting ourselves out there on YouTube, everything we do that's scary, it tends to reap the biggest reward. So, it's worth putting yourself out there and, hopefully you can find someone who works.
And also for all the stuff that I talked about that was really sensitive, like, I'm okay to talk about it, but if you're not, all you have to say is that you don't want to talk about it.
Yeah. And then as a therapist,
or that you're not ready. Just say I'm not ready. It's fine. Like they can't beat it out of you.
No.
And they don't try.
No.
So like it doesn't have to be as deep as what I did on a first session. So.
Yeah, and like I said, it's just kind of, I think every therapist I've seen, they kind of let you guide it. So that's why when she came in, I'm like, well, what brings you in? A lot of people ask that. What brings you in? And you can say whatever you want. You can say, I've just been feeling down, I've been feeling anxious, or I'm having trouble at school, or I'm having trouble with my parents, or whatever. And we can just take it from there.
Yeah.
So,
very good.
Yeah. Cool.
So this is Therapist Kati Morton, and she makes videos on mental health, eating disorders usually in the beginning, but now she's expanded self-harm and anxiety and bipolar and all that kind of thing. So what you have, you might find on Katie's channel.
Yeah, or if there is something that you're wanting me to talk about, I can add that to my list of things.
Sure. And she's on lots of social networks. She's a social network queen.
If there's a social network, we're on it, right? That's just the way it is.
So I'll have her link in the channel because I'm no good at
the little
linking her face.
Click here.
Okay. So bye YouTube.